1 in 6 men will be diagnosed with prostate cancer at some point in their lives, and this year 200,000 will get the news. When found early, it's one of the easiest cancers to treat. When cases are advanced, it's a different story, but there are new treatment options.
Good girl, Mama. Good girl.
George Pato has stage 4 prostate cancer.
I actually got her 2 weeks after I got told that I have cancer. She takes care of me, I take care of her.
George's first hint of what lay ahead was a blood test that revealed a high PSA, or prostate-specific antigen.
I'm going to numb it up with some Novocaine.
In men under 50, a doctor may order other tests like a urinalysis or ultrasound or biopsy if PSA is higher than 2.4. But since it tends to rise with age, in 70-year-olds, a PSA of 6.5 is considered acceptable.
If the cancer is localized, then you can use either radiation or surgery to eradicate the cancer. And probably 70–80% of people who undergo surgery or radiation will be cured with that treatment.
But that's not the case if the cancer is advanced.
If the cancer has spread outside the prostate gland to other parts of the body, then we typically use therapies that work throughout the body. And the initial mainstay of therapy is hormonal therapy.
Testosterone is a gasoline that makes the cancer grow, it fuels it, and so forth. It's a fertilizer.
And the areas of yellow are the areas of cancer.
Hormone therapy blocks the production of testosterone that can be done 2 ways, with agonists or antagonists.
LHRH compounds, luteinizing hormone releasing hormones. And so what this is an injection that basically shuts off the circuit from the brain to the testicle to produce testosterone.
But agonists have a drawback.
They have a paradoxical effect. So these compounds actually hit the pituitary, and before testosterone goes down, it goes up. And that's probably not good for a man with prostate cancer.
Antagonists don't have that problem called testosterone surge.
When you give it, testosterone plummets down and stays down, and so does the disease process stop. People can live, 3, 5, even 10 years. 13% of people live 10 years.
Such a pretty day.
But eventually, the cancer outsmarts the treatment.
Unfortunately, it's sort of a yin and yang. Initially, it works for the vast majority of the patients, but the vast majority of patients eventually end up resistant to the therapy.
That was the case for George.
I was running out of options.
Let me have you open your mouth, yeah?
He is among the 1,200 patients enrolled in the clinical trial of a drug not yet approved called MDV-3100. Unlike hormonal treatments that stop the body from producing testosterone, this drug locks in on the cancer cell.
This drug prevents hormonal pathways from being activated in cancer cells.
Its aim? To starve the cancer to death. It's too early to know if it's succeeding for George, but his quality of life has improved.
He's put on a few pounds since he started taking the drug. He's experiencing less pain related to his cancer.
It has brought on me a lot of hope.
The Boston Braves, they were going 9 innings every time.
Like many baseball fans, Bud Doherty knows sometimes to win, you have to go into extra innings.
Remember? Yes, yeah.
They still show that on TV.
He's lived 16 years with prostate cancer. At first, he had radiation and surgery, but his PSA kept going up, which meant the cancer moved beyond the prostate.
Let me take a listen to your chest.
Yeah.
Like George, Bud enrolled in a cancer trial. This one, at the Dana-Farber Cancer Institute, is testing a vaccine called Prostate VF.
We're not talking about vaccines in the sense of preventing a virus like polio, but we're talking about therapeutic vaccines that treat the cancer by revving up the immune system in some way to try to fight the cancer.
In a 3-year study, 30% of patients who got the vaccine are still alive versus 17% who received the placebo.
It was for a number of years that the vaccine stabilized his cancer before he had to move on to other treatments.
Prostate VF is one of several vaccines undergoing clinical trial, but not yet approved for patients. Another called Provenge is already approved.
Absolutely thrilled that it was a positive reaction.
Bud is now 77 and is grateful for his own outcome and for the opportunity to be a medical pioneer.
I want to be part of something that works, and so people will not die at younger ages and can benefit from it.
There is conflicting opinion on when men should get PSA tests. American Urological Association guidelines call for a baseline PSA screening at age 40, but suggest annual testing may not be necessary. Some experts believe it leads to unnecessary treatment and risky side effects.